At the University of Kentucky College of Medicine, you will find endless possibilities while you are surrounded by brilliant and dedicated physicians, scientists, and learners. With a combined total of 25 basic science and clinical departments, we are a hub for collaborative discoveries across the Commonwealth and beyond. Because of our breadth of skill and research strengths, our college exceeds $200 million in external research funding this year. This achievement makes us well-positioned to discover new, innovative solutions and to have direct impact on our patients and standards of care. As an academic medical center, our clinical partner, UK Healthcare, forms a solid foundation for learning at any level and ensures our residents and fellows are able to explore every facet of healthcare while inspiring a lifetime of learning. UK Healthcare includes all UK hospitals and has over 80 specialized clinics, more than 140 outreach programs, and a team of 9,000 physicians, nurses, pharmacists, and healthcare workers, all dedicated to patient health and igniting passion in our residents and fellows.
All of UK College of Medicine's graduate medical education programs have robust clinical experience and learning opportunities. Through our partnership with UK Healthcare, our residents and fellows train in the region's top-ranked hospital, as well as Central and Eastern Kentucky's only Level 1 Adult and Pediatric Trauma Center and Kentucky's only National Cancer Institute designated facility. Over the last several years, our GME programs have grown considerably in size and number. We currently have more than 70 ACGME programs spanning 4 campuses across the Commonwealth of Kentucky. These locations include Lexington, Bowling Green in Western Kentucky, and Moorhead and Hazard in Eastern Kentucky. We also have many interprofessional training programs within our GME community, including advanced training in pharmacy, dentistry, optometry, hospital administration, and pastoral care. In 2020, we welcomed over 870 residents and fellows from across the United States and internationally to UK. Across all specialties, our residents and fellows are highly involved in providing excellent patient care as they work with faculty trained in the most sophisticated medical techniques and evidence-based medicine. Beyond direct patient care and interaction, we engage our residents and fellows in systematic efforts to drive change in healthcare, including quality improvement and patient safety projects, and teaching and leadership development programs. We strive to educate physicians in Kentucky for Kentucky. In fact, nearly 50% of our program's graduates remain in the state to practice, while the other 50% are delivering care and practices across the country. In UK GME, our goal is to challenge you as you develop your skills as a clinician so that by the end of your training, you're not only well prepared to begin your career, but you've also reached your highest potential.
The Office of Diversity, Equity, and Inclusion strives to ensure the College of Medicine fosters an environment where diversity is valued, inclusion is imperative, and belonging is foundational. People come to the University of Kentucky College of Medicine to drive impact through programs such as our Women in Medicine and Science, our LGBTQ Advisory Committee, and the AAMC Restorative Justice Program, which the college has been selected to pilot. Our residents and fellows have multiple opportunities to join other allies. Our actions are intentional, purposeful, and motivated. Our strategic plan was developed to support our mission to create systemic change and ensure that we are accountable to creating an equitable learning and work environment. Residents and fellows have been heavily engaged in creating our action items and are a driving force to move us forward as an organization. But this commitment goes both ways. The College of Medicine is committed to diversifying academic medicine. And one of the ways we plan to do this is through pre-faculty development. As one of the inaugural members, we are excited to join the National Center for Pre-Faculty Development and look forward to providing trainees with foundational self-efficacy, knowledge, skills, and experiences to be successfully appointed and eventually promoted and tenured within an academic institution. In the current climate across the country, our leadership team is even more committed to addressing inequities, racism, and discrimination. And we look forward to having you join our efforts as we build a community that embraces humanity and advocates for change.
I chose to train at the University of Kentucky College of Medicine because I sought a healthcare community that offered unique learning experience amongst hundreds of medical programs. UK strives to provide the utmost quality patient care whilst maneuvering some of the highest acuity medical scenarios in the nation, in an effort to safeguard and promote the well-being of a community that extends far beyond state lines. The experience and educational opportunities have far surpassed what I had envisioned as a recently minted physician. I invite you to join our community. As a resident or fellow here, you are part of a powerful, goal-oriented team focused on our overall mission to create and maintain an exceptional and inclusive environment that fosters premier education, healthcare, and research innovations. Your training at the UK College of Medicine will provide you the tools to continue serving your future patients and communities at the highest level for the rest of your career. Beyond the hospital and clinic walls, we are fortunate to be located in the second largest city in Kentucky with ample opportunity to engage and explore your wide-ranging interests and passions. From nearby world-class hiking at the Red River Gorge, historic bourbon distilleries and local breweries, authentic international dining experiences available thanks to our city's remarkably varied and diverse communities, and plenty of opportunities to cheer on our Wildcats, Lexington is an amazing place to call home.
At the UK College of Medicine, we take complex patients and challenging research questions that may seem impossible and make it wildly possible.